Hi everyone, I am Dr. K. Hemanth Kumar, Consultant Surgical Gastroenterology and HPB Surgery at Manipal Hospital, Old Airport Road, Bangalore. Today we will discuss about bile duct strictures. Bile duct is a part of the biliary system which carries the bile from the liver. It is a connecting pathway from the liver to the intestines which carries the bile juice, which is very essential for digestion of the food. When a patient comes with jaundice or pruritus, what we call as itching, or clay colored stools, or someone is passing white colored stools, or has a significant weight loss, this is the time when we suspect that patient might have a bile duct stricture or narrowing of bile ducts. How do we investigate? We usually do an MRI scan with an MRCP, or at times a basic ultrasound will also be helpful, a CT scan, and even at times a PET scan to find out the reason for this bile duct stricture. So once we diagnose the underlying reason for the bile duct stricture, we advise the patient for preoperative preparation. As jaundice is very dangerous for the kidneys, we advise them to take high amount of fluids, high protein diet. Then coming to the surgical part, once we diagnose the bile duct stricture and its level, we subject the patient for surgical procedures. The most common surgical procedure, especially for non-cancerous conditions, when the stricture or the narrowing is near the liver, is what we do is called as Hepaticojejunostomy, wherein the bile duct, as the path is narrowed, there is no way for the bile juice to enter the intestine. So we bypass, we take some part of the intestine, we divide it and we join with the level just above the stricture. Where there is a narrowing, we join the intestine slightly above it with sutures, so that whatever the bile is there, it is diverted to the small intestine. And there are different ways of doing these things. One is the open surgery, which is the most common depending upon the level of stricture. The other two surgical options we have is laparoscopic surgery or robotic surgery, which are minimally invasive surgeries or keyhole surgeries, which have better outcomes in terms of postoperative pain and also postoperative comfort and also cosmesis. Once the surgery is done, the patient will be in the hospital for 3 to 4 days, and once the patient is discharged, we call them for follow-up after a week. By that time again we will repeat the liver function test to look for the level of the jaundice parameters and the wound healing status, and once everything is clear, the patient will be ready to resume his normal activities and his work related activities by 2 to 3 weeks.